Hello, everybody. This is JD. Now, what am I going to talk to you about today? Actually, something that I've talked to you about several dozen times, if not longer. Medical for everybody. Now, I'm a person who truly does not believe in socialism. The biggest farce we have is the welfare system. I'm going to tell you that because I personally know how ridiculous the welfare system is. My oldest sister is one of those quote-unquote welfare queens. Believe me. And she knows how I am against the current welfare system. It is a farce and a joke. Now, the biggest problems we have with a lot of our government programs is fraud. Fake. So, what are we going to do? And I say medical for all. First, let me ask you this. Why should we, as a nation, who take care of medical around the world for nations, let a child or a man or a woman die because they don't have the money for a procedure and cannot afford insurance? I'm hearing a lot of people say that when this becomes and we have to get insurance, I don't have the money now to get the insurance. If I did, I would. So I'm going to have to be paying the fine. Typical socialist government. Socialist government says you will either do it or you go to jail, you pay fines, you are against the law. That's a socialist government. And that's what this program is, a socialist program. See, socialist programs don't work unless you make everybody participate. This is an insurance regulation and a socialist program in the ultimate of socialism. Now, this is called medical for all. How would we do it? Well, you see, I'm a person who believes in taking our resources and utilizing them to the maximum. Right now, believe it or not, everybody in this country has medical. They really do. All you have to do is walk into an emergency room. But if everyone did, that would tax the emergency room so bad that they wouldn't be able to handle everything. So all we need to do is go one step further. Just one step on that program. And that is to make a clinic, an open clinic, there at each and every hospital. Could be right alongside the emergency room. And what it does is the clinic between, let's say, the hours of 8 a.m. to 9 p.m., people who need medical would come in, and after 9 p.m. to 8 a.m., they would go to the emergency room. Now, how would this clinic be set up? Very similar to the way my medical program is. You would see a person in the clinic for your problem. They would have all your records there. That's where you'd go to get your shots. That's where you go to get your physicals. Your school physicals could be done there. A whole bunch of things, okay? At the clinic, at the hospital. What's nice about that is it's a little bit better than my program. See, my program, I go to my doctor and say, ooh, I broke my arm. She looks at it and says, she's going to write a piece of paper out and say, hey, you should have went to the emergency room. And then I have to go to the hospital and get an x-ray and all that stuff. With the clinic, you walk in, you got a broken arm, we need to send you up to get an x-ray. X-ray, we got to set a cast. We set the cast. See, so it's actually working like a real medical program. Also, what else does this medical program have? Well, you understand that we have these students that come out of medical school. They have 3 years of internship. The first 2 years should be spent at the clinic. 1 or 2 general doctors or a specialist, clinical specialist would man the clinic. Then the rest would be students that just graduated, medical students, either nursing or nurse practitioners and doctors on their internship for 2 years. This is where they will get their experience dealing with patients. They'll get to see pain at first hand. They'll get to understand and develop their doctor-patient relationship. The 3rd year, if they're going to be a general practitioner, they do this senior year or 3rd year as in the clinic. They'll become like a director, doctor in charge of area or something. Whereas if they're going to be a specialist, then they go into the hospital, into that area of specialty, and they get to try it. That's the way the program would be set up. Now, what else is it going to do? Well, you know how these specialists, phony specialists, are out there running around picking up people and getting them in? You won't be able to do that anymore with the Medicare. Because unless the clinic actually refers a Medicare or Medicaid person, just like on mine, my family doctor has to refer, they can't get the treatment. So it'll cut out a lot of these fake doctors. Also bring down the costs, because now everybody would be getting covered. So then also through the system, the clinics would provide prescriptions and other equipment that may be needed. Like if you need wheelchairs, canes, special type of brace or something, all would go through the clinic. This way here, the clinic controls everything. And of course, the clinic would report any unusual breakout of anything whatsoever to the National Center for Disease. By having that, nothing would be hidden, and we would know almost immediately when there's a problem. For example, a special flu breakout or food poisoning or anything like that. The government would immediately know and could track it down a lot faster. So as you see, these clinics would serve several functions. And understand, people, I don't believe in socialism. Matter of fact, I'm against any form of real socialism. But then, there is some things that we as a nation have always done. How many times have you ever heard of a barn raising? Well, how about someone who gets their house burnt down and everybody joins together and sends them clothing, money, and food? It's just that instead of doing it at an individual community level, this would be done at a national level. And it'll be done for something that everybody needs. I don't care who you are in the middle class. A medical catastrophe can totally wipe you out. Totally wipe you out. No matter how hard you work. And I don't feel that a child or an adult should be turned away for a medical procedure just because they don't have the multi-million dollars that procedure costs. These clinics would open the door to so many other avenues of medical advance, medical prevention, and medical health for our nation that would become the envy of the world. Where are we going to get the money for this? Heck, take it away from the UN. I don't care. Pull it away from NWO if we're giving anything to NWO. I don't care. But bring it back into this nation. As president, I would rather spend our money taking care of an American citizen medically than give it to an organization that wastes it and slaps us in the face and abuses its authority, at half of which it doesn't even have. So, listen to my medical for all. Understand, it can be done just by maximizing what we already have. And we, as Americans, can do it. We can show the world how to make a medical system really work. We're almost there, people, believe it or not. We're so close to that point that it is ridiculous, and it would not be nowhere near as expensive as this insurance regulation and this socialist government demanding you have to get. That's the way socialism works. You have a nice day. This is JD. We're not a socialist society. We are a republic. But we can use things to our advantage. Have a nice day.